When you go give blood, have you ever wondered how good quality your blood is? Like, apart from the different blood types, is everyone's blood the same or are there differences? Well, it turns out there are differences. I'm just on my way to go visit a company who are doing some really interesting thing looking at the different qualities of different people's blood. And it's all to do with blood platelets. Hello, Elizabeth.
Hi, Dominic.
Hi, how's it going?
Mm-hmm.
Wow, check out your view. That's pretty great.
My name is Elizabeth Mara. I am a PhD in physical chemistry, and I'm the president and chief technology officer of Light Integra Technology.
Elizabeth has lots of experience working in blood transfusion medicine. Our blood is mostly made of 4 parts: red blood cells, white blood cells, plasma, the fluid that carries these around, and platelets. Platelets are, well, here's Elizabeth.
Platelets are very small cells in the blood, about 200,000 per microliter, so a huge number is circulating in the body. And platelets actually don't have a nucleus, they don't reproduce themselves. And this means when somebody doesn't have enough platelets, they need to get them from donors, because you can't just sort of grow platelets somewhere. And the main purpose of platelets is to stop bleeding. So when there's a wound, the surface changes and the platelet recognizes that, and they start sticking, and they start telling their neighbor platelets to come and stick, and they form a plug, and that stops the bleeding.
Platelets can exist in 2 forms. When they start out, they're round and called resting platelets, but if they're stressed, they become active and change their shape.
Platelets are very sensitive to all kinds of stresses, and so then they become activated. And the activated platelets, they show morphological signs and other signs of being stressed.
This is important for transfusion medicine because some platelet donations might contain the resting platelets and others might contain the stressed activated platelets, and these different kinds will behave differently in the patient's body.
There are about 10 million platelet transfusions given mostly to cancer patients, but also bleeding and surgery patients every year worldwide. And so you have all these many donors who donate platelets, and then they're produced into platelet bags, platelet concentrates, and transfused to patients. And currently, they're all treated the same. So there's no way of easily and quickly to determine whether there's a difference in their composition and whether they would be as useful to one patient or another patient as they could be. So the technology is actually addressing this problem of not knowing what's in the bag, and helping people to make better decisions as to direct them depending on their composition.
Where would these be applied?
Mm-hmm. So cancer patients have very low platelet counts, especially when they have blood cancers, because their bone marrow doesn't make enough platelets, and then their treatment will even decrease the platelet count further. And so they have a very high risk of bleeding, and they need platelets that are circulating in the body, not ready to adhere to everything, but ready when the patient would start bleeding. So they need platelets that are viable, and the way we characterize them is like homogeneous platelet populations, not pre-activated. When a patient is actively bleeding and they're in a surgery or they're a trauma patient, they need platelets that are ready to go, that will attach to a wound and stop the bleeding. So actually for these patients, platelets that are pre-activated might be a much better choice. And so we have these platelets in the inventory currently, but we can't tell. And one thing that is quite obvious with pre-activated platelets is that they have fragmented off microparticles, and that's one good characteristic to look for.
Mm. Elizabeth and her team have developed a technology to tell which bags have got resting platelets in and which bags have got activated platelets. And those microparticles are a good indicator that a bag has got the activated platelets in it. I asked Elizabeth to show me how her technology works, and it all starts off with a platelet bag.
So platelets are kept in plastic bags that are breathable and that are kept on rockers so that the platelets are constantly moving as they're used to in circulation in the blood in the body. And there are pieces of tubing off the bags, and from the sample of a piece of the tubing we can do our testing. So this is just another piece of tubing with water and food coloring to make the content visible. We cut the tubing, we inserted the capillary and filled the capillary with the sample in the tubing. So this is non-invasive sampling. And then once it's sealed, we wipe the capillary and put the sample into the Thrombolux device. And what's happening is the laser light is illuminating a tiny little piece of sample in a capillary, and the light reflected off the moving particles in the suspension gets collected by a detector. And so that detector now can tell the little bit of difference between the original light and the reflected light that now has the speed information in it.
The detector bounces a laser off the sample and detects the change in frequency of the light that's reflected back. The laser light enters the sample with a very specific frequency, but when it bounces off things, the frequency changes, and this is known as a Doppler shift. If the light bounces off something moving very quickly, it changes the frequency a lot, but if something's moving very slowly, then the frequency doesn't change very much. Now the particles bounce around and move a lot more quickly than the platelets, and so you'd see a bigger Doppler shift, a bigger change in frequency, if there are microparticles present than if there are just the platelets. And remember, the microparticles are a sign of the activated platelets.
In the end, we will get the size distribution displayed on the screen, and it can, for example, show lots of microparticles and platelets are very heterogeneous, or it could show no microparticles and only non-activated resting homogeneous platelets, and then you decide who gets what.
So what I think is really cool about this technology is that you've got this resource, bags of platelets, but you can now use them more effectively just by being able to image them and find out the kind of platelets that are in each bag means that you can then route those to the patients that really need them. And I think it's so cool that just by building a device that shines a laser on it, you can actually get that information out and it can improve the patient's outcome, which I think is a really cool use of physics. Okay, I'm gonna go now. Stop taking up all these important scientists' time.